How do we prepare for lumbar artificial disc replacement surgery? And I'm not going to tell you all the simple stuff that you know anyway. Stop your anti-inflammatories and all these other pills and stuff. That's not what I'm getting at. This is how to mentally prepare. And I think it's important you have a good visual of the surgery itself. How do we do it? So you feel confident in what the surgeon is doing and how many have they done and what exactly in the heck are they doing. So we make an incision in the abdomen and we go between your ab muscles. We do not cut any muscle. We go around your intestinal cavity. Your intestines, it's like a Ziploc bag of spaghetti. Push it out of the way. And we're looking at the spine. Our vascular surgeon moves the blood vessels. I clean out the disc and put the disc in. It takes an hour per disc, maybe, and he just lets everything fall back in place and stitches the fascia that holds your muscle and your skin. Pretty straightforward, honestly, and very safe.